This school was started nearly 25 years ago when my parents, upon visiting Tanzania, were asked by their hosts from the Lutheran Church if they would help start a school for physically disabled children. Back then, and even today, there's no school like it, where children live in a residential setting, they receive health care, proper nutrition, physical therapy, and live in a loving environment. Additional services.
In Africa, the fate of children with disabilities is sometimes not good. The Faraja Fund Foundation works to provide surgeries, medical care, and education for these children in Tanzania.
Dave Tolmie is chairman and co-founder of this organization. Good morning, Dave. Thanks for joining us this morning.
Thanks so much. Glad to be here.
So is it because there's a stigma for disabled? What is the challenge in Africa?
Yeah, stigma is certainly very evident there. Children born with a disability are often seen to be a curse. That's getting better generationally.
Yeah.
But the other problem is just poverty.
Yeah.
And many of the children born with a disability live remotely, the mothers have poor nutrition, and that causes a very high incidence of disability. It's a burden on families that have nothing to start with, and this makes it worse.
So how did someone, your father, get started and make this happen over in Tanzania?
Yeah, my dad and mom, after my dad retired, visited various parts of the world just to check things out.
Yeah.
It was not characteristic of them, but they came to Tanzania as guests of the Lutheran Church in Tanzania, who were hoping to start a school for children with disabilities that identified the need but didn't have anybody to help make it happen. And that's where our family stepped in to help them realize their dream.
And I wonder, I imagine you have some remarkable examples of people who have gone through this educational program and have done well.
Yeah, they do well on a number of levels. One is many of these children come from extremely destitute situations. They are literally living on the dirt floor of the family home. So the fact they get to come to the school where they have proper nutrition, health care, it's a loving environment, and there are other children like them. It's a boarding school, so they stay there from kindergarten through 8th grade. Many of them come unable to walk, and they leave because of the health care they get walking.
Wow.
And that's truly, it's a miracle of modern medicine. Then we support all those children in secondary school or vocational training, and many of them have gone on to earn degrees as a nurse, as a teacher, that kind of thing, yeah.
I can imagine there's only a limited number of spaces in the school, and has it expanded at all?
There are. We have ramped up the school to 100 students because of dormitory space, et cetera. And our whole foundation is funded basically by donations from friends and family. And to take care of 100 students and then support them on after they graduate is a lot.
Yeah.
And so we've limited ourselves just to one school. But we have a new program that we've just started that I'd be delighted to tell you about. Yeah. So a couple of years ago, we challenged ourselves with what can we do beyond the Faraja School to help children with disabilities, and that has led to a program called Faraja Forward, where we're reaching out into the most remote areas of Tanzania. Again, I've been there over 40 times. We have partnerships with healthcare providers, hospitals, physical therapy groups, emotional groups, and through those partners, they have helped us develop a strategy where we have a mobile healthcare clinic to go out into villages on a frequent basis and diagnose those children, what do they need, and get them the healthcare they need. In addition to that, we are training their parents and the local healthcare workers who amazingly have no idea what to do to help these children so that they can support the children. And also we're supporting the mothers through counseling services to let them see that it's not their fault. And that's as important as any of this.
That's great. And what's the reaction been from the local government? Do they help? Do they get in the way? Or are they just on the sidelines? Or?
It's amazing. We work closely with them because that has to be the case in countries like Tanzania. They have been so supportive, and in fact, just as we've started to ramp this up over the last 4 or 5 months, the government has formed their own committees that are required by law, but they don't do it. And they've seen the example that we're setting, and we hope that this advocacy of the rights of children with disabilities and the love and care for them is something that we can set an example, and we're getting incredible feedback from them now. In fact, I'm meeting with a number of government officials when I go over there next year. They're pretty enthusiastic about it.
Well, it's amazing. For more, you can check out farajaschool.org. You can also follow them on Instagram and Facebook. Pleasure to meet you. Thanks for being here.
Thanks so much.
Thank you. Time